everyone, and thank you for joining us this evening for the Patient Information webinar. My name's Jan Antons. I'm your first presenter this evening, and I work as Business Development Manager at Virtual. I'm here also with my colleague Daniel Owen, who you'll hear from shortly, who will present on the software, and Dan is Territory Manager and Product Specialist for the Americas. And I'm also joined by Claire Hardy, who's Global Product Specialist at Virtual, and Claire is our tech wizard this evening. You'll notice that the microphones have been muted, so if you want to ask a question or you have a comment during the presentation, please just pop it in the chat box and Claire is going to pick that up. And you may have noticed this meeting is being recorded. You will be edited out, so there won't be any images of you within the edit and the final recording. So I just wanted to let you know that. So a couple more people I wanted to introduce are Tammy Vivian, who's our product specialist for the UK and EU. And we've also got a couple of other people on from Virtual, Claire Hanforth, our Finance Manager, and Fiona Law, our Business Manager. And apologies if I missed anybody else from Virtual. So welcome to our event. We are going to just give a small presentation on how Patient Flex, Patient on Demand, VERT are three sort of products in existence or in development can be used for patient information. And then Dan is going to give a demonstration of the software. And then at the end, we're very much looking forward to hearing about how you do patient information, how you give patient information to your patients in your clinic, and how you see maybe our products fitting in to that pathway, if you like. And we've got some ideas in one of the slides. So if anyone's got any questions now, please ask. Otherwise, I think we'll go ahead with the presentation. So Patient Flex, it is a new product for Virtual. It's a product that is a subscription-based product, which allows you to be able to have the VERT software, but without the need for hardware. And you'll notice the name Flex in many of our communications recently. And the Patient Flex is very much focused towards patient information. Getting the slides to work remotely. So Patient Flex, what is it actually? Well, it is a seamless platform to engage patients. It provides structured tools for information delivery. And some of the things that it does is to enable you to be able to load individual Diacom data for your patients if you wanted to do, for example, a one-on-one session. And it also enables you to do group sessions. And because of the way the licenses are structured, you can also add licenses if you want to use it in multiple places within the clinic to be able to deliver that information successfully to your patients where you need it. We also have the ability to deliver beams, and of course you're going to see that shortly, and to show the real-time devices like MLC to show how those protect their organs at risk, and therefore patients can perhaps understand as well what patients are actually, what organs are actually in the field and may end up being receiving some dose of radiation. So it just really helps the patient to understand a bit better. And of course, we've got various models. You already may know about TrueBeam, Halcyon, Versa HD, Agility, Electro-Agility, and we've also got the IBA Proton and the Varian ProBeam machine as well. So very much for external beam, but also for proton therapy as well. And one of the things that all of our products come with is expert training from our product specialist team, who are all clinically trained therapists. So let's just move on to the next slide then. So this is the patient pathway. So we were thinking about where we think VERT or patient flex or patient on demand would sit within the patient pathway. And we very much welcome during the discussion at the end what you think about this. But when the patient first receives their diagnosis in the oncology clinic, for example, then they may have lots of questions about what radiotherapy is, what it will be like. And so being able to just deliver that little bit of information to them early on may well help the patient to understand why they might need that treatment and what it will involve. So just a bit more able to deliver informed consent, really. And then looking at the kind of pre-treatment, the sort of next step of the patient pathway, being able to say to the patient, well, we're going to ask you to drink a certain amount of water, or we're going to ask you to lie in a certain way in an immobilization device, and then the patient will be able to understand why you're asking them to do that. And so perhaps improving compliance at pre-treatment, but also during the treatment as well. And then, of course, for first day chats or just prior to first day chats, patient information is delivered. And of course, you can deliver, as we said, to the individual patient or maybe a group of patients. For example, I've seen our products used for a group of breast patients who were wanting to just see what happens just before treatment. So there is that option, really. And then even in a mid-treatment review, or maybe if the patient is struggling to comply or wants more information, is quite anxious, then our products can certainly help the patient to understand better and therefore be a partner in their care and feel perhaps less anxious. And then maybe even at the end of treatment review to actually see the treatment. We've picked out a few examples of literature that references patient information. This is not an exhaustive list, it's just an example list, really. But I think it certainly demonstrates how beneficial VR can be for patient information. So in one paper from Ellis et al. From Royal Stoke Hospital, they found that 80% of patients and family members actually wanted to see their own treatment, which would be an individual with their Diacom plan, with the oncologist or a radiographer actually running through what the treatment involves. And the patients said, obviously, help them to reduce anxiety and to build trust in the treatment process. And that was Leong et al. Who said that. And then in a non-vet study 2 years ago, 93% of patients said that the VR session helped them to get better understanding. And then there has been other references from Lord et al. From LSBU, 97.4% of patients said it helped them to understand the importance of the pre-treatment preparation. And they also said that 100% of them said the session gave them a better understanding. And 97.4% enhanced their knowledge of radiotherapy side effects. And of course, that links back to informed consent as well. So let's move on to what benefits there might be for the clinic in terms of using our products. Certainly, they allow you to deliver patient-centered care, and with groups or individual sessions, helps with understanding of treatment. It helps with the latest technology as well that might perhaps provide a competitive edge in terms of how patient information is delivered, and also access to our VERT community, to user meetings and events, and also to teaching materials. So we realise that sometimes when a new product arrives, you need perhaps help getting started with that product and making it work for you right away. And so what we've done is we've built some information sessions, and in fact, Dan is going to demonstrate one of those sessions for you tonight. But of course, everything we do is about the patient. We're patient focused, and so the patient does have benefits as well. There in the slide, we've got an image of one of our new patients that we have that will help deliver patient information, the patients are more in the treatment position, we have more models available, and also they fit on the immobilization devices, so further sort of enhancing the information process. So patients can actually really visualize themselves on the treatment couch, which I think will help them, but they will also see that the machine won't touch them in any way, and it can help to tailor the information session to how the patient wants it to be, and it makes them partners in their care, which is of course important, that sort of patient-centered, person-centered care. So reduce anxiety, increase compliance, we've talked about these things, but as well as that, to share with the family and friends, because they can't go into the treatment room, what actually happens, how the machine moves. And certainly we've seen our software used for proton patients, for children, for example. The parents have actually seen the patient's treatment plan and kind of understand what happens during the actual treatment. So we'll come to the discussion at the end, and we have just some kind of structured questions. We very much welcome your input on things, and I'm now going to hand over to my colleague Dan, who's going to give you a demonstration of the software. Thanks, Dan.
Thanks very much, Jan. That was great. I just wanted to reiterate what Jan said and say thank you to everybody for joining. We really appreciate it on behalf of everyone at Virtual. It's lovely to see you all here this evening. So as Jan said, what I'm going to be doing is just giving a brief overview of some of the software. I'm going to be basing it on sort of a prostate cancer information session that anyone really, whether it be a radiation therapist, oncologist, anyone that's sort of qualified to give over that information to the patient. Because we believe in the effective patient communication, and we think that an effective patient information session, whether that be on the first day of their treatment, whether it be a few days before the first day of their treatment, can help not only the patient through, as Jan's already said, alleviating anxieties and stresses, but also can then help streamline the service in the clinic by reducing the time that patient's in the room, by sort of helping that patient get all through those fears and questions before their treatment starts. So moving on, this is a part of our software here that's fully immersive. Everything within this system moves around and is completely immersive, as I said, for the patient. So it's a really great way to introduce the patient and their family, if they wish their family to be there, sort of introduce them into the treatment room themselves. So a really good way to alleviate, like I've said, those fears. It's a good way to show the patient how they're going to be lying, how the treatment room is actually going to look. As I said, all of this is completely sort of movable, and we can really show the patient how they're going to be lying and how we really want the patient to be in the same position as when they have their planning CT, whether it was a CT dose diagnostic or just the radiotherapy planning scans. So as you can see here, we've got this basic patient with a headrest and a knee bolster, just to make sure that we want to explain to the patient that this is how we're going to be lying, and we need you to keep as still as possible for us. So then moving on, linking back to what Jan said in that presentation just here, what we've got within this patient is the patient's Diacom Scan. So link with one of those examples that Jan gave us previously, where a lot of patients and families said it was really helpful to them to be able to see their own CT scan, to go through it as well. So what we can do is go through, show the patient what exactly we took of the scan, what we're looking for. As you can see, this bladder here has got quite a lot of contrast in it. So why have we done that? Why did we do that? So what were the results of them taking that contrast? Is a really good way to get the patient thinking about it, get that information across. It's a really easy way to visualize it for the patient rather than just having the information sort of just spoken at them. We've also what we can do is add in these information slides, just so, like I said again, we can really sort of get that patient to visualize the knowledge as well as just sort of hearing it from us as well, just so that, we all know that if a patient we're speaking to gets a lot of information thrown at them, half the time most of it goes in one ear and completely out the other ear. So it's a brilliant way to let the patient think about it, see it, really soak up that information as well with their family. If they're writing things down, it's good for them to go through it. And so what we've done here as well is capabilities to add in these information slides. So we know that if we're looking at a scan, for people that haven't been trained when looking at scans, we can all know there's a lot of grey inside a patient. So a really nice way to get through it is to then compare it to these labeled diagrams to really show the patient what we're going through and what we're showing them. So what we can also do is we've combined the patient's Diacom data that we've taken from their CT, and we've put it into this patient here that was on the bed previously. So as you can see, we've made this patient slightly transparent as well, just so the patient can see how they're going to be sitting, whereabouts we're actually going to be treating, and what sort of areas and what we need to avoid and what we're looking for to get them in that correct position as well. And so what we've done here as well is it's a lot of information to take in. So if patients are getting a little bit overwhelmed, we can reduce all of the information that's on the bed. So if they didn't want to see it within a person, they just wanted to see what exactly we're talking about, then we can go ahead and give that information across properly. So a really good way, as I said previously, just to let the patient really visualize what we're talking about, what we're looking at, and what we're going through. So again, what we can do is we've just added in these small information slides that will come with this, and they can see just where it's just easy for us to then carry on talking about as we say, the tolerances for radiation, what we're going to be aiming to treat, and just going through those side effects and everything to let them go. Going on from the side effects here, this is a fantastic tool to help be able to use the patients to really understand how and what's causing those side effects through the treatment, because I know all of us try as hard as we can to get that information across, to say that this is going to be, that there are going to be side effects, that there's some things that we can't do without, and this is a really good way to show that patient why, and the family as well. So as we can see here, this the sort of inferior part of the bladder is getting quite a high dose, and then the sort of anterior portion of the rectum, and then we can show them that that's what's going to be causing those side effects of the actual treatment itself. So it's a fantastic way to get that information into the patient and really get them to understand what's causing these issues that they're going through. Again, we've just added in some information slides just to get the patient to really understand about what we're talking about when we're going through it. So we've also added in about some benign prostatic enlargement, about sort of what can happen, sort of what are the root causes of these as well. And then we've just got a little bit of diagnosis just to go through here as well. I won't go through all of them for you. So what I've done now is within this presentation, we're going to go through and show the patient sort of through each of these organs that are at risk, go through the bladder, the rectum, and then we've gone through the prostate as well. So it's a good way to really introduce the patient to their treatment, because it's a very quick sort of roller coaster ride from diagnosis to treatment, and we want that patient to really feel like we're putting their needs above everything, getting sort of that person-centered care really nice, and getting them to really understand that we're there for them as well, and we want them to be comfortable on their treatment. So what we've done here is we've just added this bladder information slide to get them to understand sort of why the bladder's there, what's going to be happening, to make sure that it's an organ that is at risk of the treatment, that will be getting those sort of radiation cystitis kind of side effects, to make sure that is going to be happening. And so this slide here, what we really wanted to be able to get across to patients sort of with everyone at the clinic, is what Jan was saying previously about having that consistency really explained to the patient to get through and understand everything that's going on. So as you can see in this slide here, we've got quite a large bladder, and then say for this one just beneath it, quite a small bladder. I want to be able to explain to the patient there that if that bladder is a lot smaller or bigger than how it was at the CT scan, that's going to really pull up or push down some of that soft tissue and those organs, to make sure, and then that's going to be really difficult to treat. Probably have to get them off the bed, things will be sort of a lot more difficult. So it's a really, really good way to be able to show these patients why we ask them to do so many things. It's not just because we want to make their lives even more miserable. We need it to make sure everything's going absolutely sort of as we need it to go through. And then so what we've got here is we've just got The beam coming out of the head of the gantry, as we can see, we've got this 3D bladder surface here that's being combined with that CT scan. So we can go through and show the patient what exactly is going to be treating and why, what area of it is going to be getting that radiation and what's causing that to go through. And then so moving just below here, we can show that we've actually got those 3D surfaces of the prostate and the SVs and those GTVs and everything to make sure that this is the area that we're treating. However, there are issues that come by with that. As we try to shield as much as possible, but this is what's going to be getting hit at this particular point. And then later on, we'll go through and show them the whole. So that this is a VMAT treatment, go through and show them the MRCs and what we're doing to protect them as well. So there's just some more information on the slides just for the patient. So it's easier sometimes if they can read it rather than listen to it, rather than us just providing that information. But equally, we want to make sure it's fair for everybody. So that's why we're there, to be able to say it and read it at the same time. So then this just links to some bladder side effects. I was just talking previously about the radiation cystitis, and it's a good way to link. So why is this happening? It's because we can see the radiation is hitting the bladder through some of our other issues, and then henceforth is causing these side effects. So it's a really good way to sort of root cause analysis to get that reason why that's happening. So moving on, we're just going through to the rectum to explain to the patient that this is what's also going to be treating. As you can see, everything inside soft tissue, organs at risk, are all very close together. So then we've just got some more information on the rectum. Then going through here, what we're showing is that we've got a rectum that's full of gas, full of fecal matter, and then we've also got them that look quite empty. Equally, having those differences in the treatment can really cause the side effects to change, and we really want everything to stay as the same as it can do. And then so I know a lot of places now are doing sort of pre-treatment things like enemas to make sure that these are sort of minimal as possible. So this is a great way to sort of explain to those patients why we're making them do these things again before the treatment itself, because we want them to understand everything that's going on. We want them to think, though, like I say, understand everything that's happening to them during their treatment with us, during their whole pathway from the first day to the last day to the follow-up and everything. And there we are, just linking it to some of the side effects as well. Excuse me. So we've got some slides in here about diagnostic imaging as well, with MRs, PET CTs. So if they do have to have these pre-treatment, post-treatment, we can also give them a very brief overview of as to why this is happening, why they're having these scans, what we're using them for, what are we using them to look at, how can we tell them. And then so equally, if they have had a pre-treatment MRI, we can go through and we can show them this as well, take them through it. Just like I said previously, in those examples, it helps not only them, their families, all of those questions, all of those anxieties and feelings, to help them go through and tell them this is what we're looking at, this is what we're planning for, and this is why we're doing this. And so we've just got some information about these diagnostic scans, just in case they have to have them, when they have to have them, because they will have to have them eventually throughout the treatment. And then that's a really good segue to lead on to the actual planning of the radiotherapy treatment. So we can show them just a little overview here of every treatment plan is bespoke. It's completely tailored to them, which is why we have these rules, that we need them to stay sort of as still as possible. We have to have the bed exactly the same as when they went through their CT scan, to really make them understand that, right, this is really sort of where I need to be, and that's how we need them to stay. And so we can also show them their contours on the CT scan that have been contoured by the oncologist, to go through and show them that this is the areas that we're going to be treating. However, we do have this margin expansion rule to make sure that if there are any subtle movements, everything's still covered, that we're still being able to treat. And that's why, again, the sort of side effects can happen as well if things aren't quite slightly where we need them to be, but also everything's still covered and that we need that treatment to go ahead. Brilliant. And then, so like I say, I've just got some more information on the sort of organs of risk, what's being outlined, why is it being outlined. You can go through and check the whole treatment. As we can see, it's all the way up the rectum. We've got the prostate and the femoral heads, which is fantastic. And then, so this is another version of how we have the dose distribution mapped onto the 3D surfaces previously. This is just us putting that dose distribution onto the CT scan. It's just another way for the patient to be able to visualize what we're looking at. So again, we can see there's a real sort of hotspot around the prostate and the SV, some of the vesicles for us. And then you can see that sort of going sort of more superior on the patient. We can see that rectum's getting quite a large dose, inferior, and then more superior as the bladder is wrapping around the prostate. You can see that that's also getting a high amount of sort of dose as well. And we can show them that this is what's causing those side effects once again. And then, yeah, just some more information slides on it. And then, so what we're going through here is the different treatment machines as well. So obviously every clinic is different. We go through, everyone has different types of treatment, different machines, whether it be Varian, Electa, IBA, like we've got down there, protons. But we really want to make sure that the patients understand that everything is completely individualized for them. We're there for them, for their support, that person and patient-centered care, to get it across that is what we're there for. And then, so it's going into the daily treatment. What we want to be able to go through is make sure that they understand why we're asking the questions that we're asking. So, for example, making sure that we're understanding, that they're understanding that we're IDing them every day, making sure it's definitely that person, not because we don't think it really matters, but we think because we so many patients go through, we need to make sure that we're definitely, because they're so bespoke, that we're definitely getting the right patient, which of course we are. And then, so moving on, this is depending on the clinic again, we've got this immobilization within the treatment itself. So whether on that first slide, some people are going for the less immobilization, the better, I know. And then some are going towards more of the indexing as much as possible to make sure that patient is definitely in the correct position, to help try and reduce those sort of re-images and to help reduce resetting up the patient, which is what we want to get across to the patient as well. So if they come in and they think, well, that's quite a lot of sort of why I'm lying and all of this, so you can say, well, we want to get you on there to get you as still as possible, to get you in exactly the right position, that we have that planning CT MR, just to make sure that everything is completely reproducible for us. And then again, just some more information on the daily treatment itself, sort of getting the measurements correct, making sure that we're doing everything perfectly for the bed. And then this is just another great opportunity once we get sort of down here to ask the patients, do they have any more questions, any sort of anxiety, stresses that we might need them to talk about? Because by going through all of these sort of consultations and patient information sessions with the patients, we know there's a lot of information for them all to take in. It's a great way just to round it back to the start, and have they got any questions about the information they've just given? That's brilliant, and they usually do. And then, so just go back now, some more information for them. And then, so what we can do here as well is, this is a way to go through and show the patient what we're going to be doing. Why did we give them those tattoo marks? What was that for? Why are we sort of drawing on them to get these correct? So we'll just turn off these lights, and then, for example, what we're going to be doing, showing them that we're lining them up to these to the markers to make sure they're definitely in the right position. We want to get them in the right spot, absolutely. So this is what we're doing when we're zooming in. We need it to be absolutely perfect. We've got all the different markers on top all over the patient to make sure that they're definitely in the right position, because we're all aware, if you've got a patient on the bed, if the patient feels, why are they moving me, why can't they get me in the right position? It's a great way to show them this, to let them visualize that it's a really, sometimes we're so attention to detail, really need to get them in that absolutely correct position. So it helps them understand a lot more why, if sometimes they're struggling a little bit more to get that patient in the correct position, it really helps to get them to sort of let them understand that, let them be a lot more patient there. That sort of relieves their stresses, because if they're thinking, why can't they get me in the right position? Is it my fault? No, it's not your fault. We've just worked very, very accurately. Sometimes it takes a little bit longer. So it's a really good way to let them understand that. And so what we want to show the patient is that this is what the machine in the room is going to look like when we leave the room. We need them to stay as still as possible for us. They're going to be hearing some noises, some whirring, some beeping, all of this. But the machine is completely sort of remote activated from outside. That's all us just stay lovely and still for us, and they'll understand that why they can't see this machine, whereas it's underneath them. We want to make sure that everything is in the right position for them, and we need them to understand that, and then need them to understand the importance of staying still for us as well. And then so that's just another information slide. But then so going on, letting the patient know that a lot of our treatments now are becoming daily imaging. So it's a really good way to explain to them why we do that, to make sure that we're getting them in exactly the same position. So just let them sort of read this at their own pace. If they have any questions, go through, give them more information, sort of why we take the cone beams, if it's cone beam, MV, KV, everything like that. It's a brilliant way to go through and explain to them. I've also got this small video to explain to the patient sort of what's happening when we're taking those cone beams, that the arms of the machine comes out and we've got the KV source and the target, and to go through and show them exactly what we're going to be taking. We can also then go through, show the patient what exactly we're looking for when we're going through and looking at these images online, to make sure that everything is in the correct position. Like I said previously, to looking at the bladder sizes, the rectum sizes. We're looking sure if there's any excess gas anywhere. It's a great way to go through and show the patient what we're looking for, that they have another sort of understanding that we are imaging them to get them in the correct decision. It's for their benefit, so that they can really understand what's happening with their treatment, and they know exactly what's going on for them at each time, all times throughout their treatment. And then so once we've gone through that cone beam experience and show them what exactly we're looking for, and show them and ask if they have any questions, and once we've gone through that, then they're ready to sort of go through for the treatment as well. Then what we can do is show them, as we've got here, we've got the treatment coming out the head of the gantry. We can see the field as well, and we've got it on this side as well, to show the patient that once we play this, they can see it, they can hear what it's going to be like, because that can always be a bit of a shock to somebody if the treatment happens. And then we can also show them, like we've got here on the right hand side of the screen, the live MLC movements of what we're doing to protect them from that radiation to go through, and really get them to understand that this is where we're treating and why, and this is what we're doing to protect them, as well as provide their treatment for them. So yeah, guys, that is everything for that small presentation. Does anybody have any questions or any comments, or would somebody be kind enough to describe to us your current patient information model, anything like that?
Hi.
Hi.
This is KD from India. I just
How
wanted
you doing?
to know. Fine. Good evening to all. I just wanted to know whether this techniques of treatment has been added, like SRS, SBRT, IGRT, IMRT, just to explain the layman or the relatives of the patients.
Sorry, I didn't quite catch that. My microphone is quite bad. Jan, did you catch that?
I'll repeat it. Am I audible?
Yeah.
You are.
Yeah, I just wanted to know whether this techniques, different techniques of treatment, SRS, SBRT, IGRT, IMRT, has been put into this patient information.
Yeah, so there's lots of different types of treatment techniques. Like you said, there's VMAT, IMRT, IGRT, and we're currently working on 4D as well. Hopefully that'll be released with this as well. So the 4D treatments. Yeah, I hope that answers your question.
Okay, fine, thanks.
I mean, we have a number of the information sessions. I think there's going to be probably 10 it's released with. But as with the Vert On Demand, where we've got a number of workbooks, there will be some workbooks available, and we may release further ones as we go along and as people ask us, really. I just wanted to ask people, how do you deliver patient information? Is it through video, or do you use leaflets, or how do you think VR might fit? I guess would be quite nice to have an opinion on.
Hi, Jen. We currently use like a combination. We do have some videos that patients use, like especially before they come in for the simulation process and all of that. And then we also have pamphlets that go along with dietary things and what to expect from each of the kind of sessions, and then we also, in speeching the patient when they first come in. But I think this is a more comprehensive way of kind of doing it.
Thank you. Yeah, hopefully. I mean, I know that informed consent is an important thing, and obviously being able to explain to patients for them to feel comfortable and have lower anxiety going into treatment makes a difference. And I think Dan did an excellent job of explaining how the treatment works. And I think the thing is, it's a toolkit as well. So if the patient may be a little bit more anxious, you'd perhaps use a full body patient and maybe wouldn't peel it back. You may just move the machine around and show the patient it moving. It doesn't touch them, for example. So there's lots of ways. I wonder where in the process you, our attendees here this evening, where do you feel it best fits? In terms of, is it pre-treatment, first aid chat, during treatment? And you can type in the chat if you prefer as well. Don't have to speak. Oh, excellent. Thanks, Michelle. So Michelle's saying it fits pre-treatment and first aid chat. I think that is useful. And also, as we talked about, we've seen it used in a group setting where patients can kind of support each other as well, which has been quite nice. And that was pre-treatment, but we've also seen it during treatment within like a drop-in type session where patients can just drop in and ask questions. And we've also seen it used on a one-to-one, which of course requires more staffing, but can really help certain patients. So it's not for every patient, we don't think. Pre-treatment. Okay, Leah, yes. It really can help pre-treatment. And Dan did explain that very well, yeah, to patient preparation. Pre-treatment of first day, exactly. What do you think the main benefits are of this type of software? Oh, as a one-to-one, fantastic. That's great. And I think as well, the benefit of our software is that the headsets are really nice in terms of they give you a 3D feel, but they are quite heavy and maybe patients might not be kind of accepting of them. So the software is just, it's on a small laptop. It's not kind of imposing, if you like. It's just very easy to just sit down and give information. Does anyone have any questions for us? And please feel to type or unmute yourselves. Hi. And also chat.
I just had a quick question just about how it fits with patients that don't speak or obviously read English.
Sure, I don't know. Do you want to take that one, Dan, or I can?
Yeah, so I can do. So, I mean, if it's with patients that don't speak English, it depends on where you are, depending on if you get sort of translators in or interpreters in or do it over the phone. So if you get that, because I know how we used to do, we used to get the interpreters to come in and we'd do sort of a first aid sort of consultation with a patient in the room, and we'd just sort of speak through the interpreter. But a really good way would also be able to incorporate this would be to do that, but also have the system so they're still being able to use the system, have that benefit of the added VR understanding, and then also having that interpreter with them as well. Whether we'll be releasing some of the workbooks in other languages, I'm not sure of at the moment, but I can definitely find that out for you, and we can see if we can, and then I can let you know for sure. But as well, if you have staff that speak different languages, then equally just the way with the interpreter, it's a good way to be able to go through and explain that to the patient as well. Or if, like I say, you have staff that speak other languages and that can read and write in other languages, they can create their own presentations within the system as well that they can then use for that patient.
Absolutely. And a picture does speak 1,000 words as well, doesn't it? So I think the visuals probably help quite a lot as well. Leah, did you have something you want to say? You can just unmute yourself.
Put it in the chat, but I do think this is a great tool that would be very beneficial on many levels. I've been a radiation therapist for 35 years, and it really ties in a lot of pieces for the patient. The one thing that I would like to know is the software in uploading that information to the computer, because we do use a lot of those tools. You've just seemed to put them all together in a nice package. For the computer to run that software, would we be looking at sort of upgrades that would cost? How cost effective would those upgrades be? Because I know when I have pulled up the plans for patients and gave them a much detailed education session, one of the things I found was the computer that I was using in the education role was quite slow. So we really had to be patient, and we timed our program, or that time that I spent with the patient, so that that process was happening while I was still able to explain things to the patient. But when I was able to get the program up and running with their information, it was just sort of everything aligned beautifully, but that does take time.
It does take time. And I think one of the things about using group sessions is you can use almost a session that you can maybe just customize a little bit with supplementary information. There is a hardware requirement for the Flex products as well as there is for VERT, and we can certainly share that with you. And one of the exciting things about our new cloud-based products that we're developing, which is VERT on demand and patient on demand, is that those will just require any PC, and it's just a web interface. So we have kind of listened to people who may be struggling with hardware, and that's certainly coming. So we don't have an exact timeline yet. We think Q1 23, but we can certainly keep in touch about that.
Yeah, I think that would be a game changer, because we want things so instant, but there's a lot of data that has to be processed for that individualized custom sort of explanation of their treatment. And it would be wonderful to be able to give them that as fast as, part of that communication with them, because most of our education sessions were 15 to 30 minutes with definitely a follow-up after, depending on the patient's needs.
Exactly. Yes. Is there anything you want to add, Dan or Claire?
No, I'd like to say thank you for those questions as well. Brilliant, especially regarding sort of the spec and everything and the different languages. And as Claire's put in the chat, that there are several different languages that the workbooks will be released in, and hopefully we can release some more. But there are, like I said, you can make those slides in any languages as well. And like Jan said regarding the on-demand platforms, that will be hopefully coming soon, and that we'll have absolutely no hardware requirement as well, so you could go on any laptop, any PC. So thank you everyone for being here. It was lovely to spend the time with you all.
Ron here, can you hear me?
Yeah.
Yes,
Good.
Ron.
If you go through the information with the patient and after the session is finished, can that session be saved as a recording and put in the patient's chart?
I don't see any reason why not.
Could you screen record the information session?
I don't know. I just wonder from a legality point of view, it shows that you have taken the time to explain to the patient, and it should become part of their treatment record. Just a suggestion.
I hadn't thought about that before, Ron, but that's a brilliant point. And I'm sure if you had the patient's consent, if they signed a form to sort of keep that recording with them, then I'm sure that is a possibility. Yeah, for sure.
Just a thought.
It's a good thought, especially with informed consent,
Yeah,
etc.,
definitely.
and wanting to maybe pull something out. Yeah, very much so.
Another thing that I really think is that this is very individualized, whereas currently in therapy, I think it's just an overview of the radiation therapy process. It's not specific to patients, but I also think it's also good for the families to understand what the patient is going through, and we should really emphasize that as part of the education process.
Yeah, definitely, Ron. I completely agree. I think it's really important that that the patient doesn't feel like they're going through it alone as well. I think it's very important to tie in family members so that everyone can sort of understand, like you said, what they're going through. Definitely.
Absolutely.
Could you explain the licensing procedure? Is it going to be per PC or as per one center gets a license with unlimited PCs?
So it depends on the product, Ron. So for Patient Flex, it will be licensed per PC, but with the option to have multiple licenses if you need it in different clinic rooms, for example. With Patient on Demand and Vert on Demand that are coming out soon, the cloud-based products, they will be a number of users, a number of seats, if you like, that people can buy that work for them. So it will be scalable. And so we are working on that now. And if anyone has questions about it, they can certainly email us at sales@virtual.co.uk to have further information. So please do get in touch. Does anyone have any final questions or anything final they'd like to share?
Brilliant. Yeah. Thank you again, everybody. It's really nice to be with you all tonight. Really nice to speak to everyone. And yeah, thank you very much for joining. We really appreciate it, and we hope you enjoyed the presentation.
Thank you.